I'm back with Barbara here to answer some questions that come from my website. So Barbara, why don't you lead out with the first question?
Okay, our first question is from Denise. She's 38 years old and had under eye Botox, 11 units under each eye. She now has terrible bags under each eye, and it's been 4.5 months and she still has them. She's now having M-face treatments, but not seeing any results. Filler scares her. Is there any hope, or surgery her only option?
So 38-year-old had Botox under the eye. So the question is whether she had eye bags in the first place, because if you, or a weakness in those particular muscles that are being injected, if that's the case, Botox would tend to bring out eye bags and actually make them more pronounced. But usually after about 4 or 5 months, the Botox is worn off, which suggests that the eye bags were there from the start. And depending, again, on an individual assessment, you would want to see whether they're appropriate to use a filler anyway, mainly because of drainage issues. And if you are going to use a filler, use a small amount at a very deep plane, and the right filler, usually a very light filler. Other alternatives for treating around that area are now the sort of polynucleotides. If all fails and you're not getting the results that you want, then yes, I think you have to consider a surgical option.
I totally agree. Our next question is from Georgine. She's 48 years old and recently lost 30 pounds. Congratulations, Georgine. Her jowls and under chin is sagging. What are the non-surgical options to address this?
So I suspect this is what we're starting to see a lot more in the clinics as practitioners, where patients have undergone rapid weight loss, probably due to Ozempic. So 30 pounds is a lot to lose. And what we're seeing now is people with sunken and hollow features, facial features, because you use a lot of the fat from the face. So now we're having to go back and replace that volume. And that can be achieved by using fillers, again, not overdoing things. Or now the sort of new style of regenerative aesthetic medicine is the stimulators or the biostimulators, which would be very useful for volume production. Yeah.
Okay. Our next question is from Renee. She's 31 years old. She has nasal flare when she smiles. She read that Botox may be used to correct this, but she has never seen any befores and after photos. Does Botox correct nasal flare?
The simple answer is yes. So there's not very much to say, really. Yes, Botox can be used to treat nasal flare. Targeting those particular muscles requires a degree of expertise.
Okay, that's it, Dr. Sibthorpe.
Okay, thank you very much. If you have any more questions, please go to my website and submit them there. Thank you.